Mental health conditions like depression and bipolar disorder don't typically emerge out of nowhere. They develop over time through subtle shifts in our mood, our behavior, and our function, which unfold over a period of months or even years. For so long, these subtle shifts and their causes have been invisible to us until it's too late for us to get ahead of them. But the technology already in your pocket and on your wrist may be changing this. The very same devices which we blame for stress and distraction may be one of our most powerful tools for mental health care. They are changing what we can see and how we can respond. It's something I've come to think of as ambient mental health care, and I believe it represents a fundamental shift in how we can support mental health. And the stakes could not be higher because mental health touches almost everyone. They're in my family, they're among my friends, and I'm sure they're in your lives too. Over 1 billion people worldwide are currently living with a mental illness. And sadly, suicide remains the leading cause of death among young people in Australia. Yet the vast majority receive no treatment at all. Even in high-income countries like Australia, coverage barely reaches 50% of those in need. For those who do get help, it often arrives late, with long wait times, high costs, and care that often feels generic or disconnected from a person's lived experience. And it's during these delays that people's symptoms can get worse, their functioning can decline, and lives can really unravel. And this means that we're left managing crises rather than trying to prevent them. Now, part of the problem is that when we talk about mental health, we aren't dealing with neat and well-defined conditions that can be clearly diagnosed and treated. Two people with the same diagnosis can look vastly different in terms of their causes, their symptoms, and their outcomes. One person's depression might involve insomnia or fatigue and weight gain. Another's might involve anxiety and irritability and impairment. Unlike other areas of medicine, we don't have a blood test or a brain scan for diagnosis. Instead, our diagnostic systems rely largely on self-report and observation, methods which fail to capture the full picture of how someone's mental health unfolds over time and in response to a range of social and biological and psychological forces. It's kind of like we're trying to understand a story by only reading a few scattered pages of a book. And this is the reason why so many people in our work tell us that mental health care can often feel like a process of trial and error. Less than 50% of people will respond to their first course of treatment with mental illness, whether that be with psychotherapy or medications. Now, this doesn't mean that those treatments don't work, because they do. Cognitive therapy, medications, behavioral activation, lifestyle interventions, these are all effective and evidence-based treatments at our disposal. The trouble is figuring out what works for you and why. But as a society, we continue to fund more services, more people, thinking that this alone will solve the problem. But more of the same, more appointments, won't help us because we still lack the tools to measure and respond to mental health conditions effectively. Without better ways to understand your own personal and dynamic patterns, we will continue to intervene late and miss critical opportunities to improve people's lives. But this is changing because now we can measure mental health and its influences in a more continuous way, rather than only having a single snapshot at a given point in time. Think about what your phone already knows about you right now. Knows how many steps you've taken, knows how well you slept last night, it knows how much time you spent on social media, it even knows that you're in a room filled with people right now. Now, you might not think of this as health data, but research is showing that it can be. People who are depressed tend to visit fewer locations throughout the day. They move less. They send fewer text messages and receive fewer calls. These kinds of digital traces leave what is called a digital phenotype, which basically just means that your daily habits, your behaviors, they form a kind of behavioral fingerprint, which we can use to learn more about you and your mental health. And now, biosensors and wearables are taking this even further. They can measure and monitor the body's biology and key markers that are implicated in the cause and the course of illness. So stress hormones like cortisol or sleep regulating hormones like melatonin, things that have only been measurable in a lab, can now be measured in everyday life. But I want to stress, this isn't about hitting 10,000 steps a day in the same way that we're told this is good for our physical health. No, this is more about tracking your own patterns over time to detect and learn meaningful shifts. Because with data science and AI, we can learn to spot changes in key behavioral and biological markers, which might indicate that your mental health is getting worse and we need to do something about it. It may be a gradual shift in your sleep-wake schedule, or a dip in the level of physical activity, or the fact that you've been doom scrolling social media for hours each day. Patterns that maybe you don't notice, but when they're analyzed and tracked over time, they become visible. And when we do this, the amazing thing is that when we do this continuously, we can not only start to identify when someone is struggling, but we can understand why they are struggling. And we can use that information to design interventions that work for them specifically. So maybe low mood follows nights of disrupted sleep consistently, or another person's might follow high periods of high workload and limited social connection. Over time, it's about helping people learn more about themselves. And we can use these personal patterns to design interventions that work for them, that are more targeted, timely, and most importantly, grounded in that person's lived experience, not based on population averages. And this becomes a system that doesn't just watch, but it can start to act, reaching out in the times when you need it most, before things escalate. Now, at this point, some of you may be thinking this all sounds a little scary, and you'd be right to be concerned. There are real questions about privacy and ethics which need to be thoughtfully addressed so that this technology is never misused. It will require the careful design, implementation, governance, and regulation, which will require governments and services and clinicians and people with lived experience working together. We need to be clear about who owns the data, how is it being used, are the models valid, are they effective for what they're being used for? But most important, we need to ensure that this is never surveillance disguised as care. But if we can navigate those complexities, I think the opportunity ahead of us is massive. When data science, AI, wearables, biosensors, and online treatments are combined thoughtfully, they give us something we've just never had before: a highly personalized and measurement-based system of care. Now, the reason I think of it as ambient mental health care is because to me, it describes something that is monitoring and learning in the background, not always demanding your attention, but always ready to respond when you need it the most. And if you think about our current system, it's based on episodic care that occurs at a specific time, at a specific place, with a specific person. The system I'm describing is one that exists where vulnerability lives, in between appointments, late at night, and in our toughest moments. We know that early intervention leads to better outcomes. We also know that people abandon care that doesn't fit their needs. For the first time, I think we have the tools and solutions to both of these problems. The current conversation around technology, especially among young people today, centers on its harms. And rightly so. These technologies have often been designed for engagement alone, which can have absolute dire consequences on people's mental health and their development. But what if we could change this? What if we could design technologies that helped us thrive, which prioritized our mental health as its primary goal and purpose? This endeavor wouldn't be technological, and it certainly wouldn't be financial. It needs to be entirely human. To build a person-centered system of care that reaches people earlier, understands them more deeply, and responds more effectively. This is the vision for ambient mental health care, and I believe that it can help everyone engineer better mental health and well-being.